Heart. And the scary part is, it often starts silently, looking a lot like other common sicknesses. But the consequences? They can be permanent, and in some cases, absolutely fatal. This isn't some far-off threat. It's a hidden danger we really need to understand. Just take a second to read this sentence. It's from the brand new European Society of Cardiology guidelines, and frankly, it's chilling. What it's telling us is that one of the worst possible outcomes of heart inflammation, sudden cardiac death, often shows up with zero warning signs. The real damage is happening long before any alarm bells start ringing. And this is a really critical point. Myocarditis isn't just a simple infection in the heart. It's an inflammatory disease. What happens in a lot of cases is it actually triggers an autoimmune response. The body's own defense system gets confused and starts attacking healthy heart muscle cells. So this isn't a battle against some outside invader. It's a civil war breaking out inside our most critical organ. Okay, so what happens after that initial inflammation goes down and, the patient starts feeling better? Well, that's actually when the real long-term danger can start to emerge. It's not just the fire that's the problem, it's the permanent mark it leaves behind. And this slide right here, this shows you the problem. This is not healthy heart muscle. This is what's called interstitial fibrosis. It's a scar. So think of your heart like a high-performance engine. This scar tissue, it's like faulty wiring. It just doesn't conduct the heart's electrical signals the right way, which creates the perfect setup for a catastrophic short circuit. And that brings us to this really key medical concept, arrhythmogenic substrate. It means the scar itself becomes a new, ongoing threat. So long after the inflammation is gone, this little patch of faulty wiring is still there, just waiting, ready to mess up the heart's rhythm at any moment. So let me be clear, just because the inflammation is gone does not mean the risk is gone. Now, this isn't just some abstract number. This is a hazard ratio. And what it means is that when this specific kind of scarring shows up in a particular part of the heart, the septum, the risk of sudden cardiac death jumps by a factor of 4.59. That scar isn't silent. It's actively, dramatically increasing the long-term risk. So, how does this whole process even get started? I mean, how does a common illness escalate into something so devastating? The answer, it turns out, is a case of mistaken identity, happening at a microscopic level. This is the chain reaction. See, it all starts with a common viral trigger. Your immune system, of course, gears up for a defense, just like it's supposed to. But in some people, that defense goes completely rogue. The immune system starts making these autoantibodies that can't tell the difference between the virus and your own heart cells, and so they attack. It's friendly fire, and it causes inflammation and the death of heart muscle cells. And here's the really unsettling part. Just look at this list of triggers. These aren't some rare exotic pathogens. These are incredibly common viruses that most of us get exposed to all the time. The flu, viruses that cause the common cold, coronaviruses. The very things our immune systems fight off every day can, in some cases, become the catalyst for this internal attack. So, if the triggers are that common, how on earth are we supposed to identify the danger before it's too late? Well, we have to learn to listen for very specific signals, the red flags that tell us the engine is under attack, signals that go way beyond just a typical bug. And this is exactly where it gets so tricky. On the left, you've got symptoms we all know. I mean, who hasn't felt run down, had a fever, or an upset stomach? But on the right, these are the red flags for myocarditis. The danger is that the symptoms on the left can come first or even overlap with the much more serious symptoms on the right. What feels like just the flu can turn into crushing chest pain, a heart that's racing out of control, or even fainting. So at the end of the day, doctors aren't looking for just one symptom. They're looking for a very specific cluster of signs. So you take a recent flu-like illness and you pair that with chest pain that feels like a heart attack, or arrhythmias, or fainting. That combination right there sets off major alarm bells and demands an immediate investigation. But just suspecting there's a problem isn't enough. To really understand the risk, you can't just go by symptoms alone. You have to get a direct look at the damage that's being done to the engine itself. Symptoms are like the first warning shot, but the initial hard evidence, the real alarm, often comes from a simple blood test. It's looking for specific proteins that leak out of injured heart cells. And that protein is called high-sensitivity troponin. Think of it as a direct chemical signal of engine damage. When heart muscle cells die, that process is called necrosis.
they release this troponin into the bloodstream. If that level is high, it's a clear signal the heart is under attack. But it doesn't tell us where the damage is or how bad it is.
For that, you gotta go deeper. You need technology that can literally create a detailed map of the damage, showing you exactly where the problem areas are in super high resolution. And this is where cardiac magnetic resonance, a CMR, is so critical. It's really the gold standard. It lets doctors see everything. The edema, which is the swelling from active inflammation, the areas of necrosis where cells have died, and crucially, for long-term risk, the exact location and extent of any permanent scarring, the fibrosis. It basically turns an invisible threat into a visible, tangible map.
And this brings us to what is, for me, the most sobering part of this whole discussion. The fight doesn't just end when the inflammation goes away. For many people, the aftermath casts a very, very long shadow over their future. You see, a patient's long-term outlook really depends on how the disease first showed up. Now, while chest pain is the most common way it presents, and that often means a better prognosis, those who show up with signs of heart failure or dangerous arrhythmias, they are immediately put in a high-risk category. Their road ahead is often much, much more difficult. And this timeline, this shows you the relentless nature of the most aggressive forms, like something called giant cell myocarditis. For the patients who survive that first year, their 5-year outlook is still incredibly tough. We're talking a nearly 50% chance of either death, needing a transplant, or having it come back. The threat doesn't just fade away. Recurrence has been seen more than 8 years after the initial diagnosis. And that right there is why the story doesn't end when you get discharged from the hospital. Because that silent scar is still there, it's a potential source of electrical chaos. Long-term monitoring isn't just a good idea, it is absolutely critical. It's about managing a permanent structural change to the heart. So, we are left with this final crucial question. After everything we've just looked at, the autoimmune attack, the permanent electrical scar, the long-term data, the evidence is just crystal clear. The answer is no. The immediate acute danger might have passed, but because that scar remains, the risk profile has changed forever. It evolves, sure, but it never, ever truly disappears.